What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a repeat guest. I've had her on the podcast before, and we talked about a really amazing mastermind that we did last year together on ozone, methylene blue, peptides, regenerative aesthetics. And then I think I did another like little gut something for her group. And it's always good to just have a collaborative in that we share a lot of the same modalities for many reasons. And then not only that, share a lot of the same practitioners because Kim is also an amazing educator. So I've got Kim Look here today on the podcast. And today we're going to be talking a little bit about ozone therapy. Kim, welcome. Kim, can you tell us a little bit about how you got into ozone therapy?
So first of all, I'm not a doctor or a nurse. Coincidentally, I was able to get in the ground floor, and that was through my own needs and health. And it's multifaceted and a long story, but myself, I broke my back, and then my son was needing some help, and my daughter was born a little uneasy. And so just got into functional medicine. But the first practice that I found was delivering ozone and ultraviolet blood irradiation in every way. And so that really struck me, and I built my career from there. Just working a lot of practices. I've administered tens of thousands of IVs, working other practitioners. So I've seen the results and then started and built practices from there, and then trained and still train practitioners on those protocols and the basics and implementation of ozone and UV and other IVs as well, like you mentioned.
Yeah, absolutely. So I know we have like a little bit of an outline, Kim, and I know we do this all the time, but I'm actually going to change some of my questions here because we actually talked for probably about 30 minutes before the call even started, just dealing with the everyday joys of being an entrepreneur and being a innovator and a lover of change. And we just kind of fly, shiny new toy syndrome kind of situation. Kim, as you go in and you do a lot of training on ozone, neurotherapy, methylene blue, EBU, 10 pass, right? That's like a thing. I don't know. I'm not going to pretend I know much about 10 pass, but I'm going to throw that word out there because I heard you say it. What do you feel like when practitioners are bringing in IV therapy to their practice? Like, where do you feel like they struggle the most? Because I have an idea, but I want to hear you say it because I know you work with a lot of different practitioners.
Yeah, it's a really interesting and timely question because as we've been in business like a year and a half now. I mean, I was doing it previously, but we had to start over and like trying to dial in on what it is that our clients really need so we could offer that and help solve those problems. We've identified 5 stages of building an IV room and implementing different IV therapies. And so I can share that. And then what is the most might stand out a little bit more to you. But definitely like we come in and we assess and evaluate. We actually like quote unquote diagnose your IV room. And one of the first questions is like, what equipment do you have? You know, like because ozone and UV in terms of equipment are really big for an IV space. And then once you get that, specifically in the ozone world, the next step is training. Like that's the number one question. Like, how do I get trained on this? What do I need to train? Who can I train? What kind of staff am I going to need? And so we offer that like didactical, do it yourself at your pace, virtual stuff so that you can learn while also being in practice. But then we take the time to do the competency because that's the second thing is the staff has to feel really good about doing it or it won't go anywhere. And then once you get past that, the automatic next step is, well, do you have consent forms? Do you have protocols? How do I do this with other IV therapies?
Right.
Then it's like, what do I tell my patients? How do I talk to my patients? Do you have any like marketing material? And so that's the next step. So there's like the implementation SOPs, kind of that like EMR type piece of it next once I feel comfortable doing it. And then the next step is really building those treatment plans. How many therapies do I have to do? How close together do we do them? Who do we do them on? What dose of ozone? And so it's only at that point they start asking those questions. And then lastly, and this is in my opinion, the real do or die, because you can do all 4 of those steps. But if you can't talk to your patients about it, if you can't feel comfortable asking them to pay money for a service that is somewhat new to them or cash pay, etc., then all the equipment, the training, the onboarding, it doesn't go anywhere. And so we really try to work through all 5 of those stages and help you identify where that gap is. But, and for every practice, any one of those things could be like their gap. But I'll say the biggest one is the end. The biggest one is that last piece of, we know it, we like it, we have the equipment, we invested in it, we got trained, we know how to do the procedure, but we're not selling any of it.
Right.
And you can't help people if you can't talk about, what it is and how it works and feel comfortable with that. So
yeah, no, I completely agree. So I know, so the podcast that I have here, it's geared towards patients as well as practitioners. And so some of this episode is going to be probably a little bit of both. So as a practitioner who is also trained with Kim on Ozone and doing all those things, I feel like you're absolutely right. I feel like in our practice, and you can tell me if I'm wrong, I feel like we do those first like 3 or 4 things really well, right? From marketing, like say less. I got Instagram down. Like I'm going to do a case study. I'm going to talk about it on podcasts. I'm probably going to dance about it on TikTok. Like I'm going to do all these things. I've got these amazing procedure nurses and they're like sharp. They're good. They're really, really good. As I continue to build out and train nurse practitioners, we just hired our 7th one. How do they articulate it out to the patient enough where the patient understands and we're both vested in this together? So one thing that I really utilize in our practice is I like the test retest model. So I love data, right? So as you know, Min and I, we're always looking at AI. We're like, okay, we got our in-body scans and I want to talk to our EMR. But one of the things that we use to track a lot of our ozone progress and like, how do we know when do we recommend it? And how do we know what can we check and what can we show the patient to make it tangible? Oh my God, I did 3 rounds of high dose ozone and I feel so much better. But how do I quantify that for a patient? Because a lot of that is subjective. But how do I teach patients, this is the objective data that you're going to find with me that is going to track to show you that this ozone is working. So for me, what I do is every patient, we check a high sensitivity C-reactive protein on everybody. Everybody gets baseline, right? So that is one tangible piece of information that's not expensive to track. It tells the practitioner, we've got something going on here. And then it shows the patient. So that's part of my protocol. Whenever I'm doing ozone, they get a pre and they get a post. So that's something. Recently, I would say probably the last 6-8 months, we have started really doing a lot of what I call a longevity panel. And this is just a panel that we partnered with a company called Boston Heart. And I literally have hand selected all the biomarkers, ApoB, LP(a), ApoE, MTHFR, growth hormone. But on the inflammation side, we've got high sensitivity C-reactive protein, we've got oxidized LDLs, and we've got myeloperoxidase. So I've got 3 kind of different oxidative stress markers that I know methylene blue is going to help that, telomesartan is going to help that, Cialis is going to help that, ozone is going to help that. There are so many things that I can do. So as this patient's practitioner, we have to understand the why. Like, well, why am I doing that? Well, because it'll get on your inflammation. But what is that? Why? So I think from a patient perspective, you need to be able to understand why is this practitioner recommending this? And then how am I going to know if it's working other than you're going to feel amazing? But now you have this data. So I think sometimes, Kim, that's a little bit of the missing piece between the conversation between the practitioner knows it, but being able to show the patient the objective data, I think means more to the patient. I really, really do. My nurse practitioners, they always kind of joke because they'll shadow me. And I talk to my patient, I'm like, hey, I want to do a longevity panel. Your CRP came back this. I recommend, we call it the step up ozone. So they go standard, then high dose, and then they go 3 high dose. That's my protocol. And my nurse practitioners are like, yeah, your patients don't even ask. They're like, okay, Lexi said I have to do this. This is what I have to do. And I'm very fortunate because I've seen my patients for a very long time. Like I don't even take new patients. But I think because they know I'm going to be watching these markers and then I'm going to explain it to them that we're making progress. So I think the ability to track the progress, I think is a huge selling piece, because then the patients can see it for themselves. But I agree with you. Those are all really important steps.
Absolutely. You just expanded on, for us, what is number 4 and number 5. So when you say, hey, I know how to bring people in, I can dance it, I can talk it, I can launch it, like that is a piece of it. And I'd say that's maybe even true marketing, like getting people to you, even though they're your current patient base, you're like, hey, I just came out with a new case study, whatever. The second phase of like building that treatment plan is you can't sell something to the patient. Once they're in your door, you can't sell something you don't have. So you've done the work, and I'll take a little bit of, I helped you just a little bit. Like, what does that protocol look like? Like that step up program you just talked about. If you don't have that, if you don't know what that looks like, you can't engage people in it. So then you talk about the next step of what are those labs or elements, right, that you can track to show at least social proof. And also like the true, like number one, maybe the reason for it, right? Justification for it. And then the baseline to say we've done improvement. We do all that in stage 4 to teach people how to do that, clinicians, right? And if there's patients listening, it'll all resonate, right? They're like, I do need to know why. I would like to see like baseline, how do I know this is better? And then we also help with the subjective part, because I think that's very valuable too. How do you assess outside of tests? Because I'll tell you, I love numbers too. And we've done the testing in so many times in so many ways, and working with practitioners like you, where it's like we have kind of this roller coaster effect sometimes with ozone UV and all IV therapy. And so if you check the labs too much, whatever those tests are, and you're looking too closely, we'll say, you'll see this up and down. Sometimes hsCRP will go up and then it'll come down.
Yep.
Sometimes, leukocytes will go up and then they'll come down. And so we've learned that a treatment plan has to be in place, and we've learned that labs are very important. But what is also interesting as we've collected data is that subjective clinical assessment, right?
Right.
So asking the patient and doing that well. Because if you come into this and you say, how are you doing? That's a little too broad. And you need to, just like you would test, labs or heavy metals or anything else, it has to be like the same lab every time, right? It's even sometimes got to come from the same location to really compare notes on that. So we've standardized a patient assessment to help patients track how they're doing and be conscious and aware, almost like a journaling system for them. And then that provides data back to the provider as well to say, okay, my labs look like this, and the patient is feeling this. And how does that correlate, so that we might make adjustments to the treatment plan, and or we can sell it if we want to say that, right? Like that is sales to me. Exactly what you're saying is that communication and justifying it, tracking it, sharing that, and asking good questions to get that feedback from patients.
Yeah. Oh, absolutely. Absolutely. So we talked about, the maybe some of the markers you can track. I think that there are so many benefits of ozone that I don't think we realize. Like I kind of touched a little bit on the inflammation piece of it. So if you're a patient, you're listening, you're like, well, this is about business. Now we're going to kind of give you some education on what the hell is ozone, Kim? What is it? I feel like we just jumped right into some of the practitioner businessy type stuff, which I know you enjoy. But what is ozone, Kim, and why would a patient consider ozone?
Man, here's how I explain it, and you're good at it too, and you have your ways. But I'm like, it's kind of simple. We breathe O2, right? Everybody knows we got 2 oxygen molecules, although it's not pure oxygen that we breathe. And this is O3. So we simply call like a supercharged oxygen. And it is one of those real fundamental components of what everybody needs, right? You can go without food for a while, you can go without water for a while, but you can't go without oxygen very long. And yet, as we age and as disease may settle in, the ability to circulate good oxygen, and I know you're with Leonard and others who are talking so much about cellular hydration, and there's also cellular oxygen and cellular oxidation that are so critical to how the body responds in terms of creating its own antidote to that, right? Its own antioxidants and its own stem cells and its own benefits. And so it's really multifaceted, but it also so cool because it It really comes down to every cell and what every cell needs. And it's not actually so much what ozone itself does, because in a petri dish or outside the body, it's a little bit different than how you introduce it systemically or through IV. But it's more about what it triggers the body to do, and how the best word probably is it balances, like you said, inflammation, immune system, redox capacity, which most patients may not understand, maybe yours do. But it really helps the cells just do their functions better and really kind of get in sync with each other a lot better. And when that happens and you're uptaking good cellular oxygen, and we always pair it with light as well, then the sky's kind of the limit as to what it can do. But it's also real simple. It's a supercharged oxygen that we manufacture in the office. So ozone exists out in the atmosphere naturally with the development of moisture and energy, like lightning, sun, moisture, like on a rainy day, right? So we use that same component through a generator, as you know, in your office, and you can manufacture it on the spot to administer 13, 14, 15 different ways.
Yeah. No, I think it's so cool. And I think the fun thing about when in the office, when the ozone is on, and then when people are done with it, it's like the staff say it smells like rain or it smells like lightning. So
Fresh
yeah.
day.
Yeah. So I think that's a great explanation, kept it very simple. So the way I describe it to patients is, you've got your red blood cells and they have, their little oxidative stress and their inflammation and things like that. And so basically we take it out, we mix it with ozone and with some saline, and then we run it back into you. And so that little mixture helps with reducing some of the inflammation. It helps make those red blood cells a little bit more flexible and pliable. It improves their oxygen carrying capacity, which can be really helpful for energy, brain fog, focus, post-viral infections, autoimmunity, gut health, peak performers. If you're like, I'm healthy, but I'm like, I just want to be like the most optimized I can be, which I feel like are a lot of the patients I do see, is they're like, well, you fixed all the other problems. Like, I just want to make sure shit doesn't break. Ozone, like this is a great option. So let's talk a little bit about, so we talked about the IV, like what are some of the common conditions, Kim, that you have treated patients for, working in all the offices that you've worked for?
Yeah, that's a tough one because it is so broad, and it is so much now even used in longevity and optimization and performance, and I just don't want stuff to break. And so I've transitioned. I started out in Lyme disease and chronic disease that way, mold and heavy metals and the really sick people. I did integrative oncology for a while, and the ozone is used all over there. Then got into kind of the just more general functional medicine, just looking at the cause and using this for autoimmune conditions and almost like what's become standard these days in general. And then now into regenerative and functional medicine. So if you're a practitioner, you can kind of fill in those gaps and be like, geez, there's a lot there. If you're a patient, it really is just something I think that no matter what your challenge is, you could try because of that cellular component. And also you had a cardiologist on recently who was so good. And he was talking about the benefits of just better circulation and better venous supply and integrity and the nitric oxide. And he was talking about like the prostate being such a vascular organ. It's like, that is one of the biggest things ozone does. It just creates vasodilation and incredible microcirculation. And what does that do? When you can open up vessels and you can drive circulation or blood supply and flow, now you're also supporting more vitamins and nutrition and oxygen and those healing components just by increasing good circulation. And you can't get that from just the air that you breathe usually. You can't get that even with like putting like a mask on. Exercise helps, and there's some other, things that might, but ozone is in some ways so simple that really just delivers things at a higher level. But just by having that good circulation, high oxygen content, it can reach a lot of those vital areas.
Yeah, no, absolutely. Absolutely. As far as like safety, I think like I'm sure I'm not the only practitioner who gets this, where it's like a patient, you talked about ozone. I gave them that brochure that I made, and it's like me on the cover with my, Sozo or whatever it's called. Suzo, whoever.
Sozo, you got it.
Sozo. And then they're like, well, I went on the internet and I did some research. And I don't think I should do this because, and then like insert whatever AI thing that they found, and this is not FDA approved, and so how do you answer those types of questions for patients? And because I always go back to, like, this has literally been around forever. This is not new science. Unfortunately, this is not mainstream, but honestly, I feel like when you walk into the uterine health, like, this shit ain't mainstream anyway. But like, how do you explain to a patient, like, the safety behind it?
Yeah, I feel like if they're here with you, they're probably a lot more in tune with the challenges that are presented by just Googling information or, what AI might spit out. However, you're correct. It's not FDA approved, or the equipment's not FDA approved for medical use. And you can go search up and find the FDA saying that ozone is a toxic gas with no medical benefit. But if you read the whole thing, if you look into that just a step further, they are specifically referring to breathing ozone. And that is true. Like, to just sit and breathe ozone, the lungs don't have the capacity to convert that oxidative stress to usable material. And so it does stress out the lungs. But that's what they're referring to, not systemic, not IV, not limb bagging, not insufflations. Like, that's not what it's referring to. And also, they have run it through phase 1 and phase 2 clinical trials. What does that mean? Safety and efficacy have actually been approved. It just got dropped off for stage 3 and stage 4. And I also think, there's a lot of things in medicine that are used in mainstream medicine that are not approved. And as providers, I think a lot about what those might be. In functional medicine and regenerative medicine, I think you're on the cutting edge and the trends of what is current science. Like, there's a gap between current information and what is in clinical practice and mainstream. And they're saying that gap is getting so much bigger. It's close to 30 years now in some situations, with what we actually know to be good, viable science that could be implemented for patients. It's got good studies, it's got good safety, versus where we are in actually getting that process going and converting people into a more modern mindset. Which doesn't solve the problem of the fact that it's not FDA approved. However, it's very, very, very safe. And sometimes you have to go outside of what the conventional mindset is to find that.
Yeah, no, absolutely. I know it. And the other thing that's really interesting is, patients will say, like, I'll give you an example. Testosterone in women is not FDA approved. I'm like, it is actually FDA approved. We're just using it off label. So I think a lot of times patients will confuse the words FDA approved and something that's off label. I want to say I read a statistics, like, I don't know if it's like 20 or 30% of medications used today are actually used off label. So, like, I'll give you an example. Testosterone in men is off label for erectile dysfunction. It's on label for male hypogonadism. Like, riddle me that. Like, what?
It's a perfect example. Example. And you as providers are allowed to make that discretionary choice with your understanding of things. Like, that's nice that you have that potential to think for yourself and to look a little deeper in our research. And it is misleading, because anything FDA approved, there's a list of things it's approved for. But people usually leave that off. They usually leave off those details. Totally. Or it's not approved for this, but it is approved for this. And then we just kind of lump everything into it to be able to use it. And sometimes, as you know, with peptides or, I was going to say levothyroxine, but that's not it. Anyway, it's all in the dose.
Yeah.
Right. Sure. Like, you get a much different effect with different doses. Ozone's not dissimilar from that. Like, in the proper dose, it's a lot safer than outside that dose.
Yeah.
And that's also up to the skill set and understanding of the providers. And so as the public, we have to trust you with that. But you do have that flexibility in your licensing and in your experience and education.
And I think another common question that, like, I know that when I've been on the MedMasters webinars, like a lot of them is like, like the consent and like, what do you say? And I think as a practitioner and even as a patient, like fully understanding like these treatments are not FDA approved. Here are the benefits. Here are the risks, and here are the alternatives in the conventional world. So the alternative to, for helping your inflammation, ibuprofen, like, it's an anti-inflammatory. Or we could save your microbiome and your kidneys and we could do this. So I think it's hard. I think, I know all of us practitioners, we go into this to help patients. And so I think, again, working with a knowledgeable trainer, I think is also really important. So you make sure you really understand the modalities and kind of how it works and the benefits and the risks and things like that. So we've talked about a little bit about IV ozone. Can we talk a little bit, Kim, about some of the other applications of ozone, from skin to scar to ears to sinuses to vagina to rectal ozone?
Yep, you got it. There's like a ton there. And that's one of the challenges and also one of the benefits of being exposed to ozone, whether you're a provider or a patient, is like there's a lot of ways to do this. And I appreciate what you just said in terms of good training and good understanding and good protocols. Our motto at MedMasters is like protect the patient, protect the provider, and protect the medicine. I think it comes down to that. But so every time you want to, you guys, I know in your office just brought on like a yet another way to do ozone, and you're like all over again. What's the protocol? What's the dose? What's the time length? What's the equipment I need? And that's fun because it gives you a lot of options, but it also every time you want to onboard one new thing, right? It's a process. So yeah, there's insufflation, I would say is second or third on the list to IV. And you can do it rectally, vaginally, bladder, ears, and nose. And it's supposed to be kind of the non-invasive. But rectal especially has been shown to be 90 to 95% as effective as IVs. It's a systemic therapy. And a lot of these can be done at home if a person's so inclined to get a generator and do things at home. You see that a lot in like social media groups and different things of people doing this at home. The second or third way I'd say it's very common too is musculoskeletal. And I know you do some of that too. It's just the intramuscular all the way into joint spaces and tendons and ligaments and all those injuries, et cetera, that can be done. That's a very common way to use ozone also. But a provider has to do that. And so some of the other kind of could be at home is like what you just brought on, which is limb bagging. And that's for external wounds or injuries or non-healing situations, skin conditions. I'll let you talk about your process, which is really cool. I have some similar ones. And then you've also got like topical creams. And then you've also got like drinking ozonated water. You can actually do that for like upper GI stuff. And there's probably even more I'm missing. And there's probably at this point, maybe even close to 10 different ways to do IVs. So
yeah, so we started with the IV world, which is great. We saw the great thing about IV is you get systemic, benefits from it. And then there's ozonated oil, which I know Carmen likes to use that. Carmen's our aesthetic nurse. She uses it. I don't know if it might be for acne. I think is what she uses it for people. I'd have to double check with Carmen. I know she uses
make it or you buy it.
No, I think she buys it. Or she has patients buy it. So that's another way. Another way is we use it like for otitis, vertigo, ear pain that's not related to like a cerumen impaction. And we have like the little otoscope that goes to the ozone generator. We also have the I'll do it in scar injections. I've done it in aesthetics where I'll do like 20 gamma injection in like an acne scar on the face. I've used it in vascular occlusion. So when people have a a vascular occlusion from hyaluronic acid. So on the aesthetic side, I've used it to increase the nitric oxide around where the vascular occlusion happened to help get more blood flow going to where the occlusion took place. I've used it in patients who have had filler and then, post-viral infection developed a delayed onset nodule to help kind of restore some of the tissue around it, to reduce the inflammation and to help accelerate the healing process. So lots of uses on the aesthetic side that I don't think a lot of people realize. Or that they're messing around with. I was talking to Dr. Ellis the other day, and he said something like, have you ever thought about using it in a VO? And I was like, been there, done it, already know it works. And he's like, well, good. Now I'm glad I am, also thinking about it. So I think there's so many great uses, and especially now, and this, Kim, is you're seeing the two worlds collide of functional medicine and aesthetics, but they don't call it functional, they call it wellness and aesthetics. And I'm like, well, welcome to my world. I've been doing this for the last, 7 years, which is great. I'm excited. I'm excited that there's more people offering these treatments because it's amazing. And truly on the aesthetic side, I feel like this is where regenerative aesthetics is going. Like, I'll give you an example. My O shots, we ozonate the PRP before I stick it in the clitoris to help, improve vaginal elasticity, arousal, all those things. So there's so many great things that you can do with literally just having an ozone generator. It doesn't have to be an IV. But most recently, we had a patient who had almost looks like an ulceration on her skin, on her heel. Patient has neuropathy from an intraspinal stroke. Unfortunately, she did not realize that this was happening. And then before we knew it, like here were these two big wounds. And so we used what they call a limb bag. So imagine like a really large, tight Ziploc bag, and you inflate it with the ozone gas, and it sits in that environment for about 20 minutes. And then I forget it's like a deactivator, diffuser, deconstructor, I think is the word. And then destructor, and then you deflate it. And we've seen amazing before and afters. And it's not fully healed yet, but like it's so close. So much so, I was like even toying with the idea of sending her to hyperbaric oxygen. And I was like, you know what? Before we do that, because that can be pricey, I was like, let's try some ozone, because price point is way cheaper than sending someone to a hyperbaric chamber. And it's been great. It's been really good. And not only that, like we have her on a schedule where she'll get her IV ozone twice a week, and then she gets her limb bag. And it's been amazing. So much so that her podiatrist is like, tell me more about this. Like, I need to know who this person is and how they're doing it. So it's been great. Like, I mean, I've got nothing but good things to say about all the applications in ozone. And I feel like in our practice, IV ozone, hands down, because we do our longevity panel and we're really focused on cellular medicine. I would say the second like kind of big group for me is going to be my aesthetics, just because, I always say I practice pretty medicine. And then like kind of like these odd and end like little things like, I don't know, when in doubt, let's just procaine and ozone it out. And it works really, really good. Really, really good. So
I was going to ask if I could ask you that question, but you kind of just answered it. It's just like, from a provider standpoint, do you kind of just come at it as, let's just add it? Like, why not? It's going to reduce chances of infection. It's going to create circulation.
Oh, absolutely.
And it's just like, let's just throw it in with everything because it can't hurt and it's going to make things better.
Absolutely. Oh, 1000%. 1000%. There are very few, like I'm contraindications. Like I'm like pregnancy, breastfeeding. That's all I got.
I wouldn't even say breastfeeding. There's like recent heart attack, stroke.
Yeah.
They're just, they're not probably in your office. Bleeding organs, like there's some.
Yeah, they for sure in my practice. No. So, I mean, it's a very safe, modality. Again, I always goes back to proper training, right? So, like the dose makes the poison, the injector makes the shitty face, or, like the pelleter is who, overdosed this person on testosterone. So it comes, we call it the art of medicine for a reason. And I think, when you see a practitioner who truly understands, if it works on this system, well, surely I can use it on this system. And I think for me, being, the shiny toy syndrome that we have, Kim, is I like love it because now I've used it in aesthetics in so many different ways. I'm using it in sexual wellness in so many ways because you understand from a cellular pathway, how does it work? It makes perfect sense. Perfect sense.
Yeah, you said that so well. And I love it as a provider perspective because I know so much about even what we previously talked about, like research and numbers and data, and show me that this is going to work before I, risk it or engage on, or I'm skeptical until I see some data somewhere that says it's going to work. But in this case, it really gives you that chance to think and apply something to what's reasonable and what does make sense once you understand the mechanism. And that is something like we get asked 100 times a week at least, like, have you seen studies on this? Does it work on this? Does it work on this? Is like, let's go back to the cellular pathways. Let's go back to the mechanism. Let's go back to if all it did was create good circulation, oxygenation, healing properties, would you be able to apply it? Like, does that make sense?
Yeah, no, absolutely. And I think truly like this, if you're a practitioner and you do peptide therapy, this marries very well with peptide therapy. Very, very well. So, wow, I think that was great. I'm just looking at my notes here. I think I got like literally everything I was hoping to achieve and then some. Kim, if practitioners are interested in training, where is the best website to direct them to?
Well, there's a few out there. Of course, we're one of them. And we don't do it exactly like everybody else does. And I promote all training for Ozone. Even you is one of those, especially on the aesthetic side and even the functional medicine, or especially the functional medicine side too. You've helped us as well create some resources for people. But our website is medmasters.org. And again, we work with the equipment itself. We work on the training, we work on the onboarding and compliance, and we help you build those treatment plans. And then even I just did a 2-day masterclass in January for helping practitioners understand how to present this information to their patients so that the patients will say yes and feel happy with that. So I appreciate you asking. Medmasters.org. And you can fill out free resources there too. If you go there, there's right on our homepage, there's a spot there for free resources. And what that is 5 videos. And one of these is like an overview of Ozone. And there's something that you don't do that we don't talk about together usually, which is EBOO. And so there's an overview of that. It's kind of an elitist at this point application. And then you can view the 3 different procedures so you can see if it's something you want to do as a patient or what that entails, especially as a provider. Like, is this something you want to bring into your practice? Or maybe you've got it and you want to elevate it. And so anyway, you can fill that out and then you'll get those free resources and we'll contact you after that.
Yeah, absolutely. Kim and her group will also be at Calm, which I'm not sure.
Yes.
I can try to get this to air here soon. Kim and her group will be at Calm. So if you are in the academy or you're a practitioner and you're like, I want to bring in Ozone, make sure you stop at their booth. And then, Kim's trying to get better at Instagram.
I'm not trying to get better. I try to get better at making some content that the people can use to put on there. And I know she tags you a ton and follows you, and hopefully we can be of service to you guys there too, but we are trying to get better.
Awesome. So there you have it, guys. So whenever I get asked, do you train people in Ozone? I tell them, no, I send them to them to go get trained. But I can help you on the aesthetic side. But when it comes to like setting up your IV room and all that stuff, that's these people. These people.
Hey, I wanted to ask you if this is the proper place. I know you have a lot of practitioners in your training academy and et cetera, and you do your templates and your servo stuff. Have you built in Ozone to some of those if people decide to pay for that extra?
We do. So, So we have chart parts that are in there that have kind of our step-up protocol. There are consents in there. There are practice documents. There are patient brochures that we've created. But as far as like maybe integrating them into like a IV flow sheet, no, we don't do that because we put it all in our clinical note.
Okay.
Yeah.
Sounds good. Probably good for your audience too. Great.
Yeah, for sure. All right, Kim. Well, thank you so much for always taking the time to join me in my nonsense so patients and people can understand more about all the cool stuff that we do. And I'm sure you'll be on the podcast again.
Happy to help. Thank you so much.